Hello guys, welcome to Next Level Academy JIPMER exam questions 2022 with the answer key and a brief explanation. Now we are going to see part 3. The first question is IV pyelography used for renal condition is to know option A, shape and structure of the kidney and bladder, option B, to measure the blood flow of kidney, option C, to measure the excretion of urine, option D, to check the specific gravity. Again we'll move back to the question. IV pyelography is used for renal condition is to know. So graphy always which means it's a representation of something through a graph, a picture. So now the answer is the shape and structure of the kidney and bladder. How? I'll show you something. So this is actually IV pyelography. See here, you can see actually the dye is used okay, in this IV pyelography where you can see the structure of the kidney and the bladder. So you can see the structure on the of the kidney and the bladder. Next, we'll move on to the next question. A 65 years old man admitted with the symptoms of coughing, breathing difficulty, and expiratory wheezes indicated in which condition? There are few conditions which is listed. Option A, chronic bronchitis. Option B, pneumonia. Option C, pulmonary edema. Option D, asthma attack. So here you have to see the clue, keyword. 65 years old man with the symptoms of coughing, breathing difficulty, and expiratory wheezes. Coughing and breathing, okay, it's normal. Okay, it's generally you can see in any kind of a lung disorder. But expiratory wheezes, it is something different. So wheezes it always resembles what? Nothing but wheezing. Wheezing is nothing but a high pitch whistling sound is produced because of narrowing of bronchial tubes, which is always only seen in asthma attack. Next is the client with seizure disorder prescribed for valproic acid. What is the expected common side effect? Option A, diarrhea. Option B, vomiting. Option C, abdominal pain. Option D, chest pain. Now let's see what is the action of valproic acid. This valproic acid is always it is used to treat bipolar disorders, epilepsy, migraine, these kind of disorders. So the side effects are usually it's actually a life-threatening, okay, to pancreas, stomach, diarrhea, tumors. Diarrhea is the right answer. Next question. In the school, the child is being noticed that he do some spelling mistakes repeatedly in writing. After the detailed history of child is well adapted socially, good intelligence in solving the arithmetic problems, talking with everyone with good manner and not having any other issues. So here you can see all like the child is well adapted socially, good intelligence, solving arithmetic problems. He has no issues at all. But he has only one problem is does some spelling mistake repeatedly while writing. Okay, this is the keyword. So let's see the option. First is mild mental retardation. Specific learning disorder, option B. Option C, autism. Option D, attention deficit hyperactivity disorder. They call it as ADHD. Let's see first what is mild mental retardation. Mental retardation, MR. It's nothing but always it is based on the IQ, intelligent quotient, which is uh, categorized in mild, moderate, severe, and profound. 50 to 70. 50 to 70 is mild. 35 to 50 is moderate. 20 to 35 is severe, and below 20 is profound. Students, my handwriting is very poor. Please adjust. So this is always related to the IQ. Okay, not with the spelling mistakes. Next is specific learning disorder. What is specific learning disorder? We'll see this later. Next is autism. Autism is nothing but it's a mental condition where the the child or a person finds difficult to communicate with the form of a relationship with other people. You can see the child will be alone. He will have his own world. He will not mingle with other child. You can see this typically in this condition. Next is option D, is attention deficit hyperactive disorder. This has its own explanation. Attention deficit. The child will not have a proper sufficient attention and hyperactivity disorder. The child will be always, hyperactive and impulsiveness. So here you can see the behavior of the child, not about the spelling mistakes or repeating. Okay, so the right answer is specific learning disorder. Here itself it says, okay, there's something problem with the learning disorder specifically. So the option is B. Next, we'll move on to the question. Fifth, in schizophrenia, the client with flat affect expected to show which of the following? Here the keyword is flat affect. First of all, you have to understand there are some positive symptoms and negative symptoms in schizophrenia. So this comes under negative symptom of schizophrenia. So here option is expression of lack of emotion. Option B, here the patient will not have expression of will have problem with the expression of emotions. Option B, expression of inappropriate emotion. So here the patient will have some inappropriate emotions, will not have a proper emotion, will not have the right emotion. Option C, experience not express emotion. Here it means that the patient will experience, okay, he'll experience the emotion, but he'll not know how to express. He will not express the emotion at all. So that's called flat affect. So the right answer is C. Okay, students, I hope you would have understood the explanations with regards with the question. So we'll see in the next video. Thank you. And please do like, share, and subscribe to the Next Level Academy. Your cooperation is very important for us. We value your cooperation and thank you once again.